begin today with questions to the First Minister, and the first question is from Jane Bryant.
Diolch Llywydd. What assessment has the Welsh Government made of how Aneurin Bevan University Health Board has dealt with COVID-19?
Our services in the board's area continue to be under significant pressure as reductions in community transmission are only slowly being felt in hospitals. I'm sure we are all grateful for the dedication of the board's staff as they strive to deliver the best possible care to their patients.
Thank you for that answer, First Minister. This winter has been one of the hardest periods anyone can remember for our NHS. Staff numbers have been hit hard, patient numbers have been high, and the pressure and stresses on our frontline staff has been immense. Despite all of this, Aneurin Bevan University Health Board have put in place a mass vaccination programme that is accelerating at pace, whilst also adopting their practices and services. One of these adaptations has been to offer local residents alternatives to attending A&E departments. This has helped to relieve some of the pressure on the system and help keep patients and staff as safe as possible. The Health Board and staff are doing incredible work under extreme circumstances. Will the First Minister welcome the actions that are being taken in the Aneurin Bevan Health Board area and ensure the Welsh Government continues to provide all the support it can to help support our staff and keep us safe?
Well, so thank you, Brian, very much for that supplementary question. Of course, I do very much welcome all the efforts that are made by our staff in Aneurin Bevan and across Wales under the extraordinary pressures that they have faced now for nearly a full 12 months. And of course, Jim Bryant is right. The latest challenge, that of vaccination, 50,000 vaccines now delivered in the Aneurin Bevan area, 69 of the 74 GP practices in the area delivering the vaccine last week. And that, of course, is only one of the many challenges they are facing. The board delivered 19,000 tests to residents in the Aneurin Bevan Health Board area last week as well. And yet, as Jane Bryant says, Llywydd, the board goes on innovating. And this latest innovation, their Contact First pilot, I think is demonstrating a real success. We understand the anxiety that people feel about coming into emergency departments at a time when coronavirus is in such circulation, allowing people to phone first, to have that conversation, and then to be directed to the part of the service that is best suited to helping them is an advantage to the user, but it's an advantage to the service as well. And Llywydd, as Jane Bryant suggested, of those people who phoned the service in the 2 weeks at the end of December, 81% of them did not need to attend an emergency department. 36% of callers were successfully directed to a minor injuries unit. 32% were directed to an urgent primary care centre in the board's area. And I think those are remarkable figures and demonstrates not simply the amazing efforts that staff are making, but their capacity to go on innovating and responding to new circumstances, even under the pressures that the board is facing.
Laura Jones.
Thank you, Presiding Officer. I too would like to extend my thanks to everyone at the Aneurin Bevan Health Board for all the tremendous work they're doing in delivering the vaccine, but also the extraordinary reactive ways the First Minister just said that they've handled this pandemic. As you know, First Minister, the Abergavenny Centre in Monmouthshire delivers the Oxford AZN vaccine only a couple of days a week. Although the Monmouthshire County Council and GP practices, which all have been incredible during this delivery of the vaccine, have offered to set up another centre. It would seem to me to make sense that either the Abergavenny Vaccination Centre becomes a Pfizer vaccination centre, so it could operate 7 days a week like Cwmbran and Newport are just about to, or that another Pfizer delivery centre is established in Monmouthshire, ensuring faster rollout of the vaccine. I just appreciate your thoughts on that.
Thank you, Llywydd, and thank Laura Jones for those suggestions, which I'm sure the board will know about, and I'm sure that they will be putting that into their thinking. The picture, as Laura Jones acknowledged, is changing all the time. boards are developing new centres and new GPs are coming on stream. It's an effort both to maximise the number of people on the ground able to offer vaccination, but it's also an effort to try to make sure that those possibilities are as close to people's homes and as convenient for them as possible. I think 2 weeks ago, Llywydd, I said in these questions that we hope to have 250 GP practices involved in vaccination by the end of the month. We've got 330 nearly by now, so we've well exceeded what we had expected. That's part of the changing pattern that Laura Ann-Jones referred to. I'm sure the board will have heard what she said and will take that into account as they plan to provide even more opportunities for vaccination and to do it as conveniently as possible for the people that the member represents.
Delyth Jewel.
Diolch, Llywydd. I'd echo the points made about the bravery and dedication of the Aneurin Bevan Health Board staff. They are a credit to our communities. I wanted to ask an issue about administering the vaccine in the area, please. Some constituents have got in touch with me because they are caring for an elderly relative, and the elderly relative has been called to get the vaccine that they as a carer have not. Now, I appreciate that this is something which is happening across Wales and not just in our health board area, but I think it does get to the heart of a problem, First Minister, that whilst paid care workers are in the same priority group as those over 80, unpaid carers are not, and they are in close physical proximity to those they're caring for. So surely it would make sense for them to receive the vaccine at the same time to protect their vulnerable relatives. So First Minister, could I ask if you would consider making this change to the vaccine rollout in the areas that unpaid carers are given priority to?
Well, those are important points, and they would have been very carefully considered by the JCVI in its prioritisation of groups. The member will know that unpaid carers are included in priority group 6. So they're not in the first 4 priority groups who we are focusing on at the moment, but they will be in the next set of priority groups. We have to abide by the JCVI's prioritisation list. There are many cases that people can make individually for why that list should be amended. But my view is, and it's the view of all First Ministers and Prime Minister across the country, we have to stick to the advice that the JCVI has provided to us. Unpaid carers will be included in that 6th group and therefore in the next phase of vaccination. We're working hard to make sure that people who are unpaid carers will be able to make themselves known so that they can get vaccination in that new list. We amended the advice on the Welsh Government's website to make sure that unpaid carers knew that priority group 6 included them, and in line with what the JCVI has told us, we will come to unpaid carers once the first 4 groups are concluded and we're able to move into the next tranche.
Mark Reckless.
Diolch, Lewis. I think we all appreciate the extraordinary work that staff in Aneurin, Bevan and elsewhere are doing with the vaccination. First Minister, I've had a number of constituents who've come to me saying that relatives who are over 80, or indeed in some cases in care homes, have yet to have their vaccination in Aneurin, Bevan area, yet they have other family over the border in Gloucestershire. And 5 days ago, they announced that they'd already vaccinated 85% of the over 85s. Your health minister said that we would get to that in Wales, and I hope also in Aneurin, Bevan, that to 70% at least by the end of the weekend just gone. Can you confirm if that's happened, and if not, when it will, and when we can hope to get to those 85% plus levels of vaccination of that group that we're seeing over the border?
Our ambition is to vaccinate all people, or offer vaccination to all people in those top 4 groups by the middle of February. That continues to be our ambition. The aim of getting 70% of the 80 plus age range was affected over the weekend by the adverse weather. We know that a large number of people aged over 80 did not feel that it was safe for them to leave their homes in the snow, and indeed yesterday morning in the very cold and icy conditions, and weren't able to attend appointments at GP clinics or in mass vaccination centres. All of those people will have been offered another opportunity for vaccination by the end of Wednesday of this week. So we will very rapidly make up for that number. The figures of people being offered vaccination and able to take it up in Wales over the last week have been remarkable, and that should give us all confidence that we will have offered vaccination to everyone in that group in line with the ambition that we set out at the outset.
Cwestiwn 2, Carwyn Jones.
Diolch, Llywydd. What assessment has the First Minister made of the UK Government's support for airports across the UK?
Llywydd, I thank Karen Jones for that question. UK Government support is limited to airports in England. We continue to call upon them to support regional airports across the country. The catastrophic impact of coronavirus continues to have an impact on the industry, which is not confined to one part of the UK.
I thank the First Minister for his answer. Airports, of course, are not devolved, but of course the UK Government chooses when it wishes to be the Government of England or the Government of the UK according to its whim. First Minister, since 2013, the Tories in Wales have failed to support our airports, both Cardiff and Anglesey. When the airport of Cardiff was bought in 2013, they invented a story that it had been bought at a price that was way over the odds, which is completely untrue. They allowed their ideology to count more than jobs. They didn't like the fact that it was in public ownership, and that was more important than protecting the jobs of the people who actually worked there. That airport would have been turned into a housing estate, no doubt. The councils would then have objected to that as well. Is it not the case, First Minister, that the Welsh Conservatives are not willing to support the airline industry in Wales, and that's what makes them unfit to govern Wales, both now and in the future?
Well, so the failure of the Conservative Party is manifest here in Wales, and it's aided and abetted by their compatriots at the UK Government as well. On 5 separate occasions, since the beginning of December, at senior official level and ministerially, we have tried to get an answer out of the UK Government about the £100 million support fund for airports that they have repeatedly publicised. Now, we know that £8 million of that is to go to Bristol Airport, an airport that the UK Government itself cites when it has refused to devolve APD to us here in Wales on the grounds of competition with Bristol. Yet they pump millions of pounds of money into Bristol while denying any support to airports here in Wales. It is the actions of the UK Conservatives that are undermining support for the Union right across the United Kingdom, and it is the actions of the Welsh Conservatives in the way in which they fail to support initiatives such as creating a national airport for Wales that renders them, as the former First Minister says, unfit to be part of the government here in Wales.
Russell George.
Diolch, Llywydd. I think I'll tone my question a bit differently. I was very pleased, First Minister, that Wizz Air's recent commitment to start operating from the airport was particularly good for the airport, a real boost for the airport and the aviation sector, and obviously a very difficult time. From my perspective, I want to see the Welsh Government support Cardiff Airport in order that best value can be achieved when a future government returns the airport to the private sector. And in that regard, perhaps, First Minister, you could update us on what measures that the Welsh Government is currently doing to support the airport in its future development in terms of a new marketing strategy, and also in terms of updating us on improvements to transport links to the airport, and in particular what capital investment can be put in place around the airport to help the airport to diversify and generate new sources of income.
Well, Llywydd, the actions of the Welsh Government at the moment are simply focused on helping the airport to survive through the extraordinary impact of coronavirus on the airline industry. We have provided directly a further £4.5 million in loan facilities to the airport, which we are able to do. We have submitted a state aid notification to the EU Commission for aid that is claimable through the European Union while we were still members of it. What we need to see is help from the UK government, help that it is apparently prepared to provide to airports in England, help that it is denying to airports here in Wales. And we need a different approach by the UK government. Why will it not even consider publicly funded air corridors between Cardiff Airport and elsewhere in the UK other than London? Routes that we would have to pay for, but we believe would be pivotal to the success of the airport. Why does the UK government persist in taking a different approach to other countries in Europe in relation to allowable aid for safety and security costs that fall more sharply on regional airports than large airports here in the United Kingdom? There are many ways in which the UK government could play its part in assisting the airport here in Wales to weather the enormous storm of coronavirus. We make every effort to support that airport because we know that it is essential to have a national airport to support industry here in Wales, to support passengers here in Wales. That does include, as Russell George says, improvements to infrastructure around the airport as well at the airport itself. It would be fantastically useful if the efforts we are making might be matched by those that the UK government denies us at the moment.
Neil Hamilton.
Will the First Minister agree with me that the best way that governments could support airports throughout the United Kingdom, and indeed others, is to abolish air passenger duty, which is a tax on flying, massive disincentive to people to use airports? It adds £78 to every short-haul ticket and can end up being a very total ticket price. But this, of course, would be in conflict with the Welsh Government's policy of virtue signalling on environmental policy, to which Wales can make no significant difference in global terms. But reducing the cost of air travel is absolutely vital to the survival of airlines and indeed the prosperity of airports.
Well, so of course I disagree with the member in the casual way that he shrugs off any responsibility we in Wales might have to contribute to the actions that collectively will make a difference to global warming. We are determined here in Wales that we will play our part. That's nothing to do with virtue signalling. It is simply recognising our responsibility. We will live up to that responsibility, just as the member attempts to evade it in the question that he's asked me. He will know that we have long argued for the devolution of APD. We were supported in that by the Welsh Affairs Select Committee in the report that they published on the 11th of June 2019, when the current junior minister at the Wales office chaired that select committee. It's time, in fact, Clywyd, it's long past time when the UK government allows this Senedd to have control over that tax, just as it allows the Scottish Parliament and the Northern Ireland Assembly to do the same. Then we could have a proper debate here with the member about the way in which that power could be effectively used to support the airport while not undermining the efforts we need to make to play our part in combating climate change.
Questions
now from the party leaders. Plaid Cymru leader Adam Price.
Diolch, Llywydd. First Minister, in September 2019, I asked you to set out the anticipated responsibilities of the new Child Poverty Review lead. Can you update the Senedd on the key findings resulting from their work?
Well, so a great deal has happened since the member asked me that question, in particular the intervention of the global pandemic crisis. In the crisis, the whole cabinet has taken a direct interest in dealing with child poverty here in Wales, focusing on those practical actions that we are able to take that leaves money in the pockets of families that otherwise would be taken away from it, or to add money to their weekly incomes. That is a whole government responsibility. It is led by my colleague Julie James, right across the government. We have mobilised the responsibilities that we have and the budgets that we have to offer the practical help that we are able to provide here in Wales.
Organisations working in this field in Wales have called for you to publish the findings of the Child Poverty Review, and it's regrettable they're only now being made public as a result of a Freedom of Information request. They are, however, very revealing. Not only are they contrary to your own government's policy, they're in line with what we in Plaid Cymru and others have been advocating. The report highlights, and I quote, that many of those in need are not eligible currently for free school meals. And its central finding, as it goes on to say, is that the most common suggestion was the need to expand eligibility for free school meals to a wider range of children and young people. First Minister, why do you keep on resisting this recommendation?
Well, we don't resist the recommendation. So with the changes that we have made to free school meal eligibility will result in thousands more children in Wales being able to take up free school meals than was the case under the previous eligibility regime. So it is simply untrue to say that we have not taken account of what the member quite fairly quoted as not being government policy, but our account of the suggestions that were made to us during the review. Now, the review was concluded before the global pandemic began. In November of last year, we published our Child Poverty Income Maximisation Action Plan. And it was part of that plan that led us to invest an additional £52 million in free school meals in the current financial year to ensure the continued provision of free school meals during school holidays here in Wales. It's a very direct response to the comments that were collected during the review.
Of course, the actions that have been taken now during the pandemic are welcome, but the Children's Commissioner has made the point that we do need to see the review, which is looking at what can be done beyond the immediate and turned into a concrete plan of action. Many people working in this field are pointing out that Wales has the least generous provision for free school meals across the UK. Your government's policy, as the Child Poverty Action Group has pointed out, means that 70,000 children living below the poverty line in Wales are currently excluded. And that's why we in Plaid Cymru and alongside many of those that responded to this review, charities, young people, local authorities, have made the case for immediately extending free school meals to any child in any family receiving universal credit or equivalent benefit. We know you've done the costings on that, First Minister, because you told us last week, but what is the long-term cost of allowing child poverty to persist? The children of Wales will be a priority in our manifesto. Can you say the same, First Minister?
So it's plainly nonsensical to suggest that our approach to free school meals is the least generous in the United Kingdom. We were the very first government in the United Kingdom to guarantee free school meals during school holidays. We've seen the way in which the UK government was dragged kicking and screaming to the same position as a result of campaigns citing the actions that the Welsh Government had taken back in the autumn. I've had an opportunity to discuss directly with the Children's Commissioner the reports that she herself has provided on, for example, the costs of the school day, including free school meals. Our income maximisation action plan draws very heavily on the recommendations of the Commissioner. It's why we have doubled and doubled again the number of times during a young person's school career that a child can draw down what used to be called the school uniform grant, and which now, of course, is able to be used for a far wider range of purposes. Those are the practical actions that we can take. And when this government says that we will do something, we will make sure that it is practical, deliverable, and affordable. And those are obligations that I think fall on any party that seeks to be part of government. I look forward to his party being able to explain not simply how they're going to provide free school meals for any child in any family on universal credit, but alongside everything else that his party claims to be able to deliver. Then people will know that they are being made a responsible offer, not an offer simply designed to attract a headline.
Arweinydd y Ceidwadwyr Cymreig, Andrew R.T. Davies.
Thank you, Presiding Officer. First Minister, last week there was much focus on the target of having 70% of over 80-year-olds vaccinated. I heard your response to an earlier question this afternoon, but I think it is very, very important that we know quite clearly whether you've hit that target or not. You said last week that you had day-to-day information in your possession that could give you an up-to-date picture. The Health Minister was unable to confirm that yesterday at the press conference. But can you give us a simple response today, please? Have you hit the target of vaccinating 70% of over 80-year-olds in Wales?
Well, I've already given an answer to that question this afternoon. I know there was a lot of focus last week on other things as well, but the member just needs to listen, and then he would know that his question has already been answered. The data is still coming in, but the figures we have show 72% of people living and working in care homes have already been vaccinated. That's not just offered vaccination, that's already been vaccinated. We will not reach the 70% for over 80s because of the interruption to the programme of vaccination that happened on Sunday and on Monday morning. I won't have people over 80 feeling pressurised to come out to be vaccinated when they themselves decide that it is not safe for them to do so. All of those people will have been offered a further opportunity to be vaccinated by the end of Wednesday. We are on track to deliver what we said we would, which is to have made an offer of vaccination to everybody in the top 4 priority groups by the middle of February.
You have not met your commitment, First Minister. Last week you said quite clearly, and your Health Minister said quite clearly, that was information offered by you as a government, that everyone over the age of 80, 70% of that cohort would be vaccinated by the end of the week. I heard loud and clear what the response was, but you didn't give a clear answer. You have cleared that up. You missed your target. That's straightforward. People understand that. Yesterday, for example, I could tell that the UK government had 4 out of 5 80-year-olds vaccinated, 80%. They'd hit their target. What we're seeing constantly is targets being missed by your government, and we're seeing the opening of a postcode lottery here in Wales. Last Friday, for example, there was a surgery in Barry which had 350 over 80-year-olds on their books, but only 50 individuals had been offered the vaccine and had been administered the shots. That clearly shows that in some areas there is a difference of administration and availability of the vaccine. And whilst in other areas, as the Health Minister was talking about, over 70-year-olds being called for the vaccination, can you confirm what measures you are taking to catch up with the rollout of the vaccine and ultimately make sure that the postcode lottery doesn't emerge across Wales?
Well, really, Llywyd, the member's going to have to do better than that. Here he is again in his resumed responsibilities. There is no postcode lottery here in Wales. There is an enormous effort in every single part of Wales, right across the health service, to vaccinate as many people as quickly and as safely as possible. The figures from last week demonstrate just how successful that effort has been. Instead of sniping from the sidelines, those people would appreciate just a little bit of support from the member instead of the undermining of their efforts, which of course has been his key characteristic throughout the coronavirus crisis.
Well, again, the First Minister doesn't look at the facts that's before him. Everything I've quoted him today is facts about the government's own commitment, about 70% of over 80-year-olds being vaccinated by the end of the week. The fact that that surgery in Barry that I identified had 350 people on their books over 80 and only 50 had been administered shots. The difference between England and Wales, there are now 50,000 more people vaccinated in England as a proportion of population than in Wales. That's equivalent to the town of Barry. There is a level of urgency required in the rollout of this vaccine. You yourself are on the record of talking of it not being a sprint. People of Wales want to know the speed and the rollout is catching up with other parts of the United Kingdom. And when you set yourself a target, you hit the target. I've dealt in facts today. You've constantly tried to deflect from that, First Minister. It'd be far better if when you make a commitment, you stick to it. So what are you doing to close that population gap that has opened up with England of 50,000 people? As I said, that is the town the size of Barry being vaccinated. And that is of critical importance, First Minister.
Let me give the member a few facts. On Tuesday of last week, we had succeeded in vaccinating 162,000 people in Wales. This Tuesday, that has risen to 290,000 people. That's the fastest rate of increase of any part of the United Kingdom. Last Monday, we vaccinated 10,000 people. This Monday, we vaccinated nearly 20,000 people. That is the speed of the rollout here in Wales. A speed which is urgent, a speed which is dedicated, a speed which is succeeding. He may want to run it down. He leads a Conservative Party in Wales which has reverted to its 19th century type. For Wales, see England. It's not good enough, it doesn't wash, and he's going to have to do better than that.
Question 3, Mark Isherwood.
Diolch, Clywyd. Am I on? Yes.
Yes, you are. Carry on.
How is the Welsh Government supporting self-catering businesses in North Wales during the pandemic?
So on Friday, the 22nd of January, the package of support to businesses affected by level 4 restrictions was further enhanced by an additional £200 million, taking its total to £650 million. Self-catering businesses will be eligible for element of this support, provided they meet the necessary criteria.
Thank you. Well, a single North Wales council continues to insist that legitimate self-catering businesses which do not meet all 3 Welsh Government criteria for the payment of business and lockdown non-domestic rate grants to holiday letting businesses are ineligible, leaving several struggling, telling me that their position is based on a telephone conversation with a Welsh Government official, although they confirm that the council does not have a formal written record of that conversation, and nor was there any subsequent correspondence to confirm the outcome. However, I've received confirmation from 3 Welsh Government ministers and all 5 other North Wales county councils that local authorities have discretion to pay out these grants to self-catering businesses unable to meet the 3 eligibility criteria, but able to prove they're a legitimate business. For example, Denbighshire confirmed they paid the grants out in these cases, and the officers from Welsh Government confirmed their viewpoint was valid and they were correct in awarding the grants to these businesses. Will you therefore place on record that local authorities have discretion to pay out these grants to self-catering businesses unable to meet the 3 eligibility criteria, but able to prove they're a legitimate business to their council, and confirm whether Welsh Government funding is available for retrospective payments accordingly?
Well, I think the member has accurately set out the Welsh Government's position. We have provided discretion to local authorities to apply the criteria we set out in the specific circumstances that they face. Discretion will mean that some local authorities go about that in ways that others do not. That is in the nature of discretion. The members accurately set out the Welsh Government's position on that matter.
Question 4, Hywel Anca-Davies.
Diolch, Llywydd. What discussions has the Welsh Government had with the UK Government regarding plans for a post-Brexit review of UK workers' rights?
So with any erosion of workers' rights is unacceptable, unnecessary and damaging. A race to the bottom is not in the interests of workers, employers or the broader economy. The UK Government must uphold its promise to protect workers' rights following Brexit.
First Minister, thank you for your answer. And I raised this, as you know, last week in questions. But over the course of the last week, despite initial denials, we've now seen the UK Business Secretary confirm proposals for a bonfire of hard-won workers' rights and terms and conditions, despite repeated promises from the Prime Minister that this would not happen on leaving the EU. Now, these proposals are going to leave many workers, including key workers throughout Wales, hundreds of pounds out of pocket and working longer hours for less in unsafe work. So First Minister, will you agree with me that working people who now face the prospect of working longer for less, having their hard-won rights stripped away, could feel that they've been hoodwinked by the Conservatives and their promises of a bright new future when we left the EU?
Well, so with Hugh Rankin Davis's question last week was prescient because he put his finger on this issue before press reports appeared of plans that are going on inside the UK government. Here is how they were reported. Worker protections enshrined in EU law, including the 48-hour week, would be ripped up, and the plans being drawn up by the government as part of a post-Brexit overhaul of UK labour markets. The package of deregulatory measures is being put together by the UK's Businesses Department with the support of Downing Street. Select business leaders have been sounded out on the plan. Now, is that the Morning Star reporting what's going on, Llywydd? No, it's the Financial Times telling us what is going on inside the UK government. It is a disgrace. It's an absolute disgrace that a government that made such promises to people that if they voted to leave the European Union, that their rights would be protected, are within weeks of that happening, drawing up secret plans to have a bonfire of those protections. During this pandemic, our country has been kept going by an army of vulnerable key workers, including agency workers, whose limited rights very often stem from European Union law. Ripping up those rights is no way at all to reward them, and they will not forget. They will not forget what the Conservative Party here in Wales has in store for them. In store, as Hugh Rankin Davis says, a future in which they're going to be asked to work longer for less. But we know what the Conservative Party thinks of them, Llywydd, don't we? The current Secretary of State in the Business Department was a contributor to that notorious Britannia Unchained book of less than a decade ago, when Conservative cabinet members described British workers as amongst the worst idlers in the world. Now they're able to put that ideologically charged view of the world into practice.
Janet Finch-Saunders.
Diolch Llywydd. First Minister, the UK Government has been very clear that our high standards on protections for workers were never dependent on our membership of the EU. Now, whilst we can all be proud that the UK has one of the best records on workers' rights in the world, it is true that the Welsh Government could and should be doing more. Now, let's take, for example, your self-isolation support scheme, which is aimed at those on low income who cannot work from home and must self-isolate, and yet that you're failing to make payments to Welsh people who have been told to isolate by the NHS Track and Trace app. So why don't you today explain what action you are taking to ensure that workers who are notified by the NHS app to self-isolate will actually receive the £500 payment, as they are already doing so in England under a Conservative UK government? Sure.
Well, so the members' attempt to defend the UK government's record in this matter barely amounted to being feeble. No doubt she was briefed on the fact that in the House of Commons debate on this matter yesterday, Tory backbencher after backbencher queued up to praise the advantages of what they call flexibility and a bonfire of red tape. And we know what that means. We know that in the hands of the Conservative Party, that means a bonfire of the rights of workers, hard-won rights, which of course her party has opposed at every possible opportunity. As far as the self-isolation support scheme is concerned, about 20,000 applications have been received, just under 10,000 have been approved, over 6,000 people have already received payments. That totals over £3 million. The NHS app is the responsibility of the English Health department. It has to help to make sure that the app that it provides is suitable for use in Wales. In the meantime, we will find a workaround so that people who are notified through the app do not lose out of self-isolation support payments here in Wales, because we will take that responsibility even while her party, who's actually in charge of the problem she's identified, failed to do so.
Mandy Jones.
Diolch, Llywydd. First Minister, scaremongering again, that's exactly what I expect. The answer you gave was the sort of reply I always expect from you: doom, gloom and more fear. In many areas of workers' rights, as Janet's rightly said, including maternity and holiday allowances, UK workers have enjoyed and will still enjoy far superior conditions than those mandated by the EU. And the relevant UK government minister has pledged there will be no race to the bottom. So, First Minister, let's turn this round. What would you like to see the UK government do in this area that would benefit workers in Wales? Thank you.
Well, Llywydd, the member can attempt to just to dismiss people's concerns as scaremongering. I read out for her, not my words, but the report that the Financial Times produced of this government's intentions, confirmed by Kwasi Kwarteng when speaking to the House of Commons Business, Energy and Industrial Strategy Committee only on Tuesday of last week, when he confirmed that this review was going on inside government. Number 10 has declined to dismiss what the Financial Times said about an end to the 48-hour maximum working week, about changes to rules about breaks at work, about removing overtime pay when calculating holiday pay entitlement. Those are direct assaults, particularly on the working lives of those who have the least protections already. The Labour Party will continue always to stand up for those people, to make sure that their rights are properly articulated and understood, even as she pretends that those things are of no importance.
Tynwyd cwestiwn 5 nôl.
Question 5 was withdrawn. Question 6, Sian Gwenllian. Thank you, Llywydd. Will the First Minister provide an update on the COVID-19 vaccination programme in Arfon? Llywydd, thank you to Sian Gwenllian for that question. On the 11th of January, we published our national vaccination strategy with key milestones and priorities for delivery. Within Arfon, all primary care practices are ready to deliver the vaccine. Bangor has one of the 3 mass vaccination centres in North Wales. Thank you. It was a privilege to take my mother, who is 92 years old, for her first vaccination to the major event in the Llŷn Peninsula over the weekend as a result of the excellent efforts of local medical leaders, and despite a whole host of bureaucratic barriers and snow, 1,200 people were vaccinated. GPs and health workers are doing heroic work in all parts of Wales, and our debt to them is very great. May I refer your government to one significant problem that needs to be addressed? The ICT systems at the various levels don't communicate with each other, and this is creating confusion. For example, GPs can't see which of their patients have had a vaccination appointment to one of the mass vaccination centres, and that could mean that some people received 2 appointments and that a valuable vaccination is wasted. That's just one example. Can you actually try and find a swift resolution to these IT problems? They've come to my attention in Arfon, but it's likely that they are common across Wales. Well, Llywydd, thank you to Sian Gwenllian for those supplementary questions, and it's great to hear that her mother's received her vaccination, and I've been reading over the weekend about everything that's been happening in Arfon and on the Llŷn Peninsula, and I will refer in a moment to something I saw with Dr. Eilir Hughes, who's been leading the vaccination efforts in the Llŷn Peninsula. In terms of the ICT systems, things are happening so quickly. So NWIS are trying to resolve these problems which have arisen. They are happening because everyone is doing their level best to do everything they can to provide vaccinations to people the length and breadth of Wales. And areas of North Wales have led on those endeavours. So I can tell Sian Gwenllian that we're aware of the problems and people are working very hard to resolve them. I do want to refer to one of the sentences I heard from Dr. Eilir Hughes at the end of the weekend. It is in English, so I will just quote it in the original because it does demonstrate the spirit and the efforts that people are making.
Hughes, one of the practitioners to whom Sian Gwenllian referred, who's done such a lot to provide services and innovative services in that part of Wales. This is what was said. Witnessing the joy people felt of receiving the vaccine was a truly amazing and humbling experience to witness. I am in total awe of everyone who made this happen and succeed. A team of 50 people delivering over 1,000 vaccines in 2 days. Brilliant work by the admin staff, police, council staff and so many others, overcoming unexpected snow and not a single dose wasted. Pen-Llŷn at its very best.
Cwestiwn 7, Helen Mary Jones.
Actions does the Welsh Government plan to undertake to reduce poverty in the Mid and West region?
So we thank Helen Mary Jones for that. We focus on those actions which add to or leave money in the pockets of those who need it the most. That includes aiding Welsh citizens to secure entitlement to UK-wide benefits. Our single advice services helped people in Mid and West Wales claim over £4.7 million in additional welfare benefit income last year alone.
I'm grateful to the First Minister for his answer. He will be aware of the report from the Welsh Government Centre in April 2019 and indeed the report from the committee of this Senedd. The Welsh Government Centre estimated that if we were able to secure the devolution of welfare benefits on the same model as Scotland has, we could boost the Welsh budget by £200 million a year. Does the First Minister agree with me that it would greatly assist any Welsh Government's efforts to reduce poverty if we were able to control those elements of the benefit system here? And does he understand why my constituents in the poorest part of my region, like towns like Llanelli, find it difficult to understand why the Welsh Government won't seek this power in order to be able to take that practical action to which the First Minister refers?
Well, I'm very familiar with the report of the Welsh Government Centre to which Helen Mary Jones refers, and a very useful addition it was to the developing literature on what Wales should seek in relation to the benefit system. I take a different view, I suspect, to the member. I'm in favour of seeking aspects of the administration of the welfare benefit system. I am not in favour of breaking up the UK social security system. And that's because I think that the United Kingdom offers a different opportunity to pool resources and share out rewards according to need, and that is to the benefit of Welsh citizens, particularly poorest Welsh citizens. The Welsh Government's report did say, as Helen Mary Jones says, that if we were offered devolution on the same basis as Scotland, that could lead to the sums of money the report identified. The report went on to say that it was highly unlikely that devolution on those terms would be offered to us, and set out the reasons why. So I think it's important to provide a complete account of what that report said. I'm afraid I agree with the report. It's very unlikely that the UK government would be prepared to repeat the sort of deal that they offered to Scotland, partly because they now regret that they did so. Devolution of the administration of benefits is something that I've previously agreed with Helen Mary Jones about, and I'm happy to repeat that because I think that would give us a different set of possibilities in Wales without breaking up the access of Welsh people to the advantages that come by being part of that wider social security system.
Cwestiwn 8, Bevan Syed.
How is the Welsh Government protecting and supporting all key workers during the COVID-19 pandemic?
So thank Bevan Syed for that question. Amongst the latest measures taken to protect and support key workers in Wales are last week's strengthening of our coronavirus regulations in the workplace and in retail settings in particular. Such workers have been at the forefront of our programmes in PPE, testing and now vaccination throughout the pandemic.
Thank you for the reply, and now it's clear interest because my son is in nursery daycare. I've had quite a lot of nurseries get in touch with me where staff have told me that they don't seem to be appearing on any lists for the vaccine. They feel like they've been left behind. They are working day in, day out in a vulnerable position. They can't wear PPE when they're working with very young children, and they feel that they should be prioritised for the vaccine, yet they're not hearing anything from your government. Can you commit today to looking at this again and providing nursery staff with a priority of a vaccination, because they should be appreciated by society and by Welsh Government by being given the vaccine because they're working and because they're working so hard. Diolch yn fawr iawn.
Diolch yn fawr, Bevan Syed. And can I just say, first of all, absolutely to echo what she said about the work that staff in that sector do, the nature of that work and its importance. If we need to do more to communicate to people in that sector where they lie in the JCVI vaccination priority list, and I'm sure our colleague Julie Morgan is listening. Yes, I can see her listening to this exchange, and that she will follow that up as a result of it. I'm not able to depart from the JCVI priority list for all the reasons that we've rehearsed on the floor of the Senedd previously, but where people simply feel they lack information about where they lie in the priority list and what that means for them, I'm sure we would want to do more to make sure that they know and understand that, particularly in the circumstances that the member referred to.
Cwestiwn 9, Lynn Neagle.
What assessment has the First Minister made of the impact of Brexit on the NHS in Wales?
Thank Lynn Neagle. Llywyd, leaving the European Union brings a range of adverse implications for the NHS, both in the short and long term. We work closely with the Welsh NHS to mitigate these new barriers at a time when the service is already under huge pressures from the global public health crisis.
Thank you, First Minister. And in the House of Commons last week, we saw Tory MPs vote down the Lord's amendment to the trade bill that excluded NHS data from the scope of any future trade agreements, leaving the door open to the possibility of companies using that data to develop tools and medicines to sell back to the NHS. While Tory ministers consistently tell us that the NHS is not for sale in future trade deals, their own MPs are voting against the amendment that makes that a reality. Can I ask you, First Minister, to give us your assurance that our NHS is not for sale in Wales, and what steps will you take to ensure that that is communicated loudly and clearly to the UK Government?
Well, I thank the member for that question. The NHS in Wales is absolutely certainly not for sale and not to be sacrificed either on the altar of some UK trade deal. It was deeply disappointing, I would go further than that really, that the UK Government decided to overturn again amendments passed in the House of Lords on this matter, amendments passed with the support of 3 different parties represented here in the Senedd, and our colleagues in the House of Lords have mobilised to defend the interests of the NHS and to defend the interests of Wales against the onslaught of the UK Government. Here in Wales, we will do everything that we possibly can to stand up for the Welsh NHS, to make sure that those who work in it know that they have our full support, to try to overcome the new barriers that will be there. The NHS Confederation and the Wales Centre for Public Policy's report of November, which told us that those most likely to be affected by new barriers to recruitment included ambulance drivers, social care workers, healthcare support workers and healthcare assistants. All of those people are vital to the Welsh NHS. All of those people will be harder to recruit because of the actions of this government. They could have, instead of warm words, they could have supported that amendment last week, which would have offered some comfort to people that our NHS is not to be sacrificed by this ideologically driven UK government. They failed to do so. We will stand up for them and for the NHS.
Diolch i'r Prif Weinidog.
I thank the First Minister. The next item is the business statement and announcement.